Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Do you have a glare coming through? That's weird. I have like this glare. Looks like a zzz coming straight down my face. If you see it, let me know. Hello, Becky. Okay, so today is Wednesday, February 19th. It is 5 p.m. Okay, so let's continue talking about the thyroid. Since dysfunction of the thyroid is very common and many people are unaware they have a problem with it, this might be a discussion that might open your eyes a little bit and make you think, could this be me, right? So if your doctor suspects you have a thyroid condition, they're going to order a blood test. Usually they're going to order what's called a TSH. TSH stands for thyroid stimulating hormone, which is secreted by the pituitary gland in your brain. Okay, and it tells your thyroid to make more or less thyroid hormone depending on the levels that are in your blood. Hello, Heather. So, although not 100% predictive as a test by itself, a low TSH usually indicates hyperthyroidism. Okay, so if you think about it, if your hormone levels are high, your thyroid hormone levels are high in the blood, that would suggest again that the thyroid is working and putting out too much hormone, which is going to tell the brain to send less TSH, meaning make less. Okay, slow down production, right? Hello, Teresa. Hello, Ted. Okay, so a high TSH usually indicates hypothyroidism. So if you are symptomatic and this test comes back either high or low, they're going to need to do further testing. So it's also the test that they use to monitor people who are taking Synthroid to see if their levels are adequate. Okay, Synthroid being a prescription medication. Again, not my favorite thing, but that's what most people do get in this country. So the second test that they might order is T3 and T4. Okay, those are the primary hormone levels that are the hormones that are released from the thyroid, and they will check those next. Most of these are bound to proteins in your blood. So the more accurate test is called a free T3 or free T4. Meaning they're free in the blood, not bound to proteins. The free T4 will show the levels of active hormones circulating in your blood. Because if it's bound to protein, it's not active, meaning it can't do anything. It's kind of stuck. Okay, it's stuck to something and can't do its job. So if the free thyroid hormone levels are elevated, in addition to having a low TSH, this supports a diagnosis of hyperthyroidism even more. And of course, the opposite combination for hypothyroidism. Then more tests will be needed to determine the cause. Okay, so you've determined that the thyroid is functioning too much or too little, but why, right? So number 3 is a thyroid ultrasound. Now, that's a non-invasive test where a probe is placed on the neck with the ultrasound jelly, and they're showing reflected sound waves, and it shows how the thyroid tissue looks. It can reveal inflammation, it can show masses or nodules. Unfortunately, this does not say anything about function. All it is showing is anatomy. Okay, so if you have something abnormal in appearance, and you have these elevated or low thyroid levels, they still don't know why. They're still just looking at anatomy. So the next test is called a thyroid scan. This is the test to reveal thyroid function. So you're given a small amount of radioactive iodine. Okay, they give it to you orally. It's given in a pill. Since iodine is taken up by the thyroid to produce thyroid hormone, follow-up images taken 24 hours after you've received this radioactive iodine will show areas of the thyroid taking up excess iodine or areas that are not taking up enough or areas that are not taking up anything at all. Okay, so that is a good measure. Again, not by itself, but in conjunction with all the other tests that they've gotten, they can really get an idea of how your thyroid is functioning. And lastly are antibodies. Now, this is where it gets totally confusing. So in case this didn't sound complicated enough, if autoimmune causes of thyroid dysfunction are suspected, they're going to test for anti-TPO antibodies. That's the anti-thyroid peroxidase antibody. And they're also going to test for anti-thyroglobulin antibodies. Now, thyroid peroxidase is the enzyme which is used by the thyroid to make thyroid hormone. So if your body has an elevated antibody to that enzyme, you are likely to be hypothyroid. Okay, so if your body is attacking the enzyme that makes it, you're not going to make enough. So that would suggest Hashimoto's thyroiditis. That's the most common form of autoimmune related thyroid disease. Now, thyroglobulin is the protein substrate, or the protein base, if you will, in the thyroid that is used to make thyroid hormone. So antibodies against this would likely indicate Hashimoto's. But again, it may be positive in Graves' disease, which is another autoimmune disease of the thyroid, but usually causing hyperthyroid. Now, another antibody test is thyroid stimulating immunoglobulin, which is the test most often used to diagnose Graves' disease. But typically, the thyroid hormone increases in Graves and decreases in Hashimoto's would differentiate the two. Okay, have I totally confused you? I hope not. Go back. If you have a thyroid condition, go back and listen to it and kind of take notes with arrows up and down, or compare them to your blood work that you possibly would have had already to see if what I'm saying goes along with the diagnosis you may have received so far. So, for example, I have a very close person in my life whose thyroid levels are currently elevated. She has a diagnosis of Hashimoto's. Theoretically, her thyroid levels should be low. So they're now concerned she might have Graves' disease. Well, I learned in medical school, try to fit everything into one box. It's unlikely that someone's going to have two diagnoses in the same area. Okay, so you're not going to likely have two different thyroid disorders. It's most likely one. So chances are this person had a viral infection, a cold, a flu, something which caused an inflammation of the thyroid, causing the thyroid to spill out all the thyroid hormone that was sitting there waiting to be released on command, like when the TSH told it to. Instead, it spilled it, so it looks like a picture of hyperthyroid, when in fact, she still has the same disease. She just has a cycling into a different stage of it. So I hope that makes sense. As I said, it is a very confusing topic for people who are not really aware of how important this thyroid function is and how interrelated it is with the brain and your overall body's functioning. So we're going to talk a little bit more about this. Like I said, the reason I'm doing this is because 60% of people don't even know they have a thyroid condition. So if you are having any type of symptoms, if you are having difficulty losing or gaining weight, if you're having cold or heat intolerance, if you're having difficulty sleeping, if you are sleeping all the time, the opposite, if you have anything having to do, again, with your metabolism, your hair is getting dry and brittle, your nails, altogether, this could be a thyroid condition, and it can be easily treated, some of them very naturally, but you need to know what to tell your doctor so they know what to test for. All right, so we're going to talk more tomorrow. Stay tuned for more information. I hope you guys are having an awesome day. I will see you again tomorrow for another Live in 5.